of the relatively unique things about our clinic is the model that we use with multiple surgical providers. Specifically, as of the date of filming, there are 3 of us who routinely perform vasectomy reversals: Josh Savage, Clint Brereton, and myself. Josh Savage is a physician assistant who worked with me at Mayo Clinic and who's been performing reversals since at least 2014. He currently does between 5 to 7 reversals weekly and occasionally will open up Saturdays for surgery. Clint's been with us since April of 2020 and also routinely performs 5 reversals weekly. Both Josh and Clint went through an extensive training program, including performing dozens of benchtop surgeries and over 100 cross-table reversal cases before they ever did any on their own. Their training was actually more thorough than that of dozens of residents or fellows, which I'd previously helped train while at Mayo Clinic. Possibly because of this training, when Clint started doing his own cases, his results were actually immediately similar to Josh's and mine without any clear evidence for a learning curve. But I would argue that the greatest thing about this model is that it allows us to track each other's outcomes and to compare minor differences over time. In my practice at Mayo, and in nearly every other reversal clinic, you just can't compare your outcomes against anyone else. This makes it very challenging to know how you're doing compared to others. But in contrast, with our clinic, every single weekend I do a statistical comparison of each provider to see if anyone appears to be doing slightly better or slightly worse. I also periodically review videos of the other providers' surgeries to make sure that we're all doing equivalent techniques. In the past year, there's been 3 times where it appeared that one provider was getting slightly higher results than the others. After closely observing the videos, we learned a few key principles which we would have never discovered otherwise. Just as one example of something we learned, we realized that fewer sutures, which were not tied as tightly, resulted in higher sperm counts compared to more sutures and tighter connections. Now, this is a very important finding, and honestly it had been debated among reversal specialists for decades without a clear answer. But these types of minor adjustments help us continually improve results, albeit by very small amounts. It also helps us to counsel and educate other providers to hopefully improve outcomes for reversal specialists more broadly. So, in general, if you're trying to decide who should I select among the providers, it's completely up to you. But just know we've put a lot of time and energy into making sure that regardless of who you pick, you should be getting a very similar outcome. All of our providers are very high volume and do more reversal surgeries than just about any other reversal surgeon in the US. And as a group, we definitely do more reversals weekly than any other practice, in many cases by several-fold. I hope that this video has been helpful. As always, feel free to reach out anytime if there's anything we can do to answer any questions or if we can be of any help. Thank you.